my research. We're focused mainly on trying to find new interventions to modulate muscle strength and muscle function, especially in aged. So we're more in the basic biology side, a little less clinical, but we are trying always to, find translational approaches and how we can get this to the clinic. Yes, I mean, of course, it's been a big boom. I mean, of course, one of the basic, focuses has been mostly on the TGF-beta pathway, trying to stimulate the myostatin, right? And there are a few interventions out there for sarcopenia, so they're just starting now in clinical trials. But, now there's especially more from the kind of translational approach, a little bit more of like finding new targets is coming to the forefront. So for example, mitochondrial health, there's a big boom on senolytics, also nutrition. So there's, a few forefronts on aging, trying to improve this, compendium. Yes, physical intervention, right, especially for elderly patients, getting a lot of these endurance testing, muscle strength programs. I mean, that's very big focus for geriatricians right now. Of course, ideally they're looking for a drug intervention just because of how it'll be easier, but it does seem to be a multifactorial problem. So, I don't think just one of the aspects is going to, make this a better process for aging. So I think it's going to have to be multifactorial. So not only like physical training, but also, lifestyle. If you've been sedentary all your life and you're 70 or 80, it's difficult to tell you, now get up and start doing weight training, right? But for sure, I think it's very important in this whole interventions process. And, not only would it help just on its own, but even if you do some sort of drug intervention in the conjunction of physical strength training, that would improve the whole process, basically. Well, every time I think it's changing nowadays. Now it's, like every time we're more focused on more of a holistic approach, not just, just giving a drug and hoping for it to improve. So I think there is going to be a change, in trying to prevent, especially because, we can see that our life expectancy is increasing, but unfortunately the number of chronic diseases that we have over 65 is also increasing. So basically you live longer time, but probably just not with the best, a standard quality of life, right? So I think it's important to, for doctors probably to focus a bit more on this, because, in the 40s or 50s when I think most people are probably pretty active still, and if you continue that, it's going to be a lot easier to continue, when you're 70, 80, than to, take a pre-frail individual in their 70s, to tell them to do physical training. I feel that's pretty hard. It's been very focused on, trying to find medical conditions, to try to intervene. But at the end, it's sort of what we all know from, growing up, healthy diet, good exercise, and you're going to probably live a better life, right? So I think that's key, and now, probably making like a structured program is going to be key in trying to get to this improved aging and improved quality of life. First of all, structured programs, a little bit more of a physical activity as well as diet, and structured with interventions as well. So, trying to take like a full program and, also an increase, in geriatricians, and how they're focusing on the problem and prevention. So starting a little bit earlier, 60s, already starting with some of these programs. And, there are a lot of, especially in this conference, you see a lot of trials going on, to try to figure out what are the most important, factors to take into account. But I think it will be changing. I feel in 5 years there will be a lot more information of what are going to be the best programs and better drug interventions. Basic science is also giving a lot new targets. So, not only just building muscle, traditional muscle mass building, but I feel that there are a lot of new targets that I feel will be pursued, and it's very exciting. So I hope probably in the next 5 years, maybe the first, anti-sarcopenic drug or intervention will be, recognized, and I think that it'll be an exciting time.